This is section 3, why a birth plan for a hospital transfer is important during a home birth. Planning for all scenarios during a home birth is essential, even though it can be difficult to think about the possibility of a transfer. While it's natural to focus on the ideal birth experience, preparing for every potential situation, including a hospital transfer, helps ensure that you're ready for anything. This preparation may seem uncomfortable at first, but it can provide peace of mind, knowing that you've taken steps to protect your well being and the safety of your baby, no matter what unfolds during your birth journey. A birth plan is a helpful tool that outlines your preferences, values, and expectations for the birth process. Whether you're planning a home birth or another birth setting, it should ensure your wishes are clearly communicated, especially in situations where a hospital transfer might become necessary. By creating a birth plan, you can be confident that your voice is heard, even if you're unable to advocate for yourself during a transfer, helping to guide your care every step of the way. Having a birth plan for a potential transfer offers several key benefits. It ensures clear communication, helping hospital staff understand your preferences. In moments of pressure, it supports informed decision making, allowing you to act quickly and confidently. A well prepared plan reduces stress by alleviating anxiety about the unknown. And most importantly, it empowers advocacy, ensuring that your birth choices are respected, protected, even in a hospital setting. So, when creating your birth plan for a hospital transfer, it's important to consider both your personal preferences and potential medical interventions. Think about who you'd want present during your birth, such as your partner, midwife, doula, or other support people, and ensure you communicate these preferences clearly. It's also essential to designate someone who can advocate on your behalf if you're unable to do so for yourself. Regarding medical interventions, outline your pain relief preferences, whether you prefer natural management techniques, medications like an epidural, or maybe a combination of both. Additionally, consider your preferences for situations like a perineal tear. Would you prefer sutures or would you prefer it to heal naturally? It's also important to specify whether you want intermittent or continuous labor monitoring and your stance on the use of IVs, fetal monitoring, or medical equipment such as forceps or a vacuum. Ensuring your wishes are understood and respected during your hospital transfer. When considering postpartum care for your newborn, it's important to outline your preferences for the first moments after birth. For example, you may wish to delay cord clamping to allow for optimal blood flow to your baby. Many parents choose to have immediate skin to skin contact with their newborn to promote bonding and regulate the baby's temperature, as well as blood sugar. You should also consider your feeding preferences, whether you plan to breastfeed, bottle feed, or use formula or donor milk. If you prefer minimal interventions, you can request that procedures like measurements be delayed during the golden hour. It's also helpful to decide who you want present during this special time, such as your partner, your doula, midwife, or family. You may want your partner to have bonding time with the baby as well, which can be an important step in their bonding process. Finally, consider if there are any newborn procedures like the vitamin K injection, hepatitis B vaccination, ointment for the eye, hearing tests, or anything else that you'd like to delay or decline in the immediate postpartum period. By communicating these preferences, you help create a postpartum experience that aligns with your values and supports your baby's well being. Before your home birth, it's essential to have a thorough discussion with your midwife about the potential for hospital transfer and the related protocols. Start by reviewing their transfer protocol so you understand the specific processes for moving from home to the hospital if necessary. Clearly communicate your transfer preferences, including the types of interventions you're comfortable with that are non-negotiable and those that are non-negotiable for you, ensuring your wishes are respected. It's also important to discuss hospital communication. Confirm that your midwife will transfer your records to the hospital staff ahead of time if possible, and this will ensure a smooth transition. Lastly, go over emergency protocols by discussing the signs that would indicate a transfer is necessary and how the process would unfold, so you feel prepared for any situation that may arise. These discussions will help provide clarity and peace of mind, knowing that your care team is aligned with your preferences and ready for any eventuality. I always suggest packing a bag with essentials for both you and your baby ahead of time. Make sure to include items like clothing, toiletries, your chargers for your phones and iPads, any other items of comfort that you may need. Different scenarios may require different modes of transportation. So it's important to discuss your options with your birth team in advance. Most midwives will ask about your preferred hospital for a non emergent transfer, as well as the nearest hospital to your location in case of an emergency. Being prepared for both situations ensures a smoother transition if a transfer becomes necessary. While you may not have control over the specific room you're assigned during a transfer, it is helpful to be aware of the location preferences available to you, such as the possibility of a private room or access to items like a birth bowl so you can make the best of your experience if the need arises. Your birth plan should serve as a guide, not a rigid script. It's important to remain flexible and prepared to adapt as circumstances evolve. Open communications with your birth team is crucial to ensuring that your preferences are respected throughout the process. However, always remember that your health and well being of your baby come first, and being open to necessary changes can help create the safest and most positive experience possible. In conclusion, a birth plan for hospital transfer is about preparing for the unexpected, ensuring that your voice is heard, and providing clarity during what can be an emotional and potentially stressful time. Whether you're giving birth at home or in a hospital, the ultimate goal is to have an experience that is empowering, informed, and aligned with your values. By preparing in advance, staying flexible, and trusting your intuition, you can navigate any situation with confidence and ensure that your birth journey remains a positive and empowering one. Thanks, guys. I am going to link some references as well as some tools that you may need in the assignment block as well. If you have any questions, please feel free to email me. Thanks for listening.